It is Friday, the 3rd of April. Now, we've had a bit of a milestone, I'm afraid, 1 million official cases. It's quite easy to say 1 million, but that's a lot of individual human beings. And just before I go on to look at this in more detail, I've had some emails recently from other people who were due to get elective surgery or due other treatments on the health service in my country, like chemotherapy, and these have been postponed. And this has been remarkably distressing for them. So we've got the people that are suffering directly from this pandemic. But I think we have to remember the people that are suffering indirectly by things that are not being done for them by the health services when they're supposed to be being done. Very distressing to have a chemotherapy treatment missed or an elective operation cancelled, as well as all the other difficulties that's going on. So for most of us, I'm afraid the curve is still increasing. Things are still getting worse. And this is illustrated clearly by this number here. The official cases have doubled in the past week. So a doubling of cases. It was just over 500,000 last Friday. Now we're over 1 million. And this number we know is a massive underestimate. So the modelling data we looked at yesterday, I know it's based on modelling data, but it's good quality modelling data. There's a full video on that yesterday if you want to catch up on that. That estimated that in 11 countries in Europe, there's between 7 and 43 million people infected already up to the 28th of March. So that makes that figure look fairly ridiculous because this is the number officially diagnosed almost exclusively with testing, whereas the real numbers are way, way higher, we believe. And in Europe, we noted yesterday that represents between 1.88 and 11.43% of these 11 European countries. Now, that's not so much the point. The point is that in most places the curves are still increasing, but we'll look at how that's panning out specifically. Now, I just want to mention this. I actually get I get quite a lot of mail about people saying, how dare you talk about the World Health Organization figures? The World Health Organization is a puppet for China and all this sort of thing. Well, let me try and be clear about what I think about this. The World Health Organization's performance this year has been absolutely lamentable. In my view, it's been appalling. They've been behind the curve virtually all the time. And I've just put up this famous tweet from the middle of January that they gave out. Preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus. Unbelievable. These are the people that are charged with collecting and collating information about world health by the United Nations on my behalf and on your behalf. And then they didn't close flights down from China. And then they didn't declare a world emergency, in my view, quickly enough. Then they didn't declare a pandemic quickly enough. So we've got all these completely lamentable things. But what we have to remember is individual things that the World Health Organization say are actually said not so much by the World Health Organization, but by the many brilliant people that work for them and the massively well-informed people that work for them. So I think we have to differentiate between the performance of the World Health Organization. As an organization, I give them about 1 out of 10. And the individuals that work for it, some of whom are absolutely world-class, and I will give 10 out of 10. So we have to differentiate between that. So we can't say all advice is bad from the World Health Organization because there's some world-class stuff there as well. In England, we have a curious saying you shouldn't throw the baby out with the bathwater, if that makes any sense to you. So we can cross that out. Let's be clear, there is human-to-human transmission. In case there's any ambiguity. Now, I got an email from someone that made quite a lot of sense. And I've been thinking about this since the Diamond Princess, actually. That there are many cases where this virus does seem to be spreading in air circulating systems. So air conditioning, air heating, air blowers by the doors of shops, and indeed air conditioning systems within vehicles. If they're not very well filtered, then it's worth thinking about that this virus could be spreading in air in our mechanical systems. So if possible, if your building permits it, I would suggest you think about opening windows rather than turning on air conditioning. Just something to think about there, but I think a good point. Now, coming on to specific countries. Spain. A lot of people confirmed to have the virus by testing. We know the real number is probably at least 10 times higher than that, way higher than that. Now, distressingly, the death rate in Spain is the highest in the world at the moment. The last 24 hours, there was an extra 950 deaths, taking the deaths up to pretty well 11,000. And by today, of course, it will be well over 11,000. So disappointing, really, to see that the lockdown lag effect with these deaths that we've talked about many times is so prolonged. We really hope for better by now, but this is what's panning out. The sixth day that the deaths have been above 800 cases. But we're certainly hoping that we are at the peak in Spain now, and the Spanish authorities are believing and hoping that they are at the peak of the deaths now. So hopefully we're going to see a decrease in this number. There'll still be more deaths accumulating, but hopefully the rate of increase will be decreasing. Downward trend in new cases. Now, there have been a couple of blips recently. I think it was Tuesday there was a bit of a blip in Spain. But the trend is downwards. What we have to look in these things is not so much the day-to-day numbers, although that's important, but it's the trend. So what we're seeing in Spain is that the trend of the number of new cases is levelling off. We are starting to see that levelling off now, and indeed a slight reduction in the percentage of new cases in Spain, something like that. But the problem is, as we know, the number of deaths lags 2, 3, 4, 5 weeks behind this. So unfortunately what we're seeing is this similar shaped curve, but what this means is we could carry on seeing more deaths, as indeed we have been seeing lately, but the curve will start to follow and follow the same trajectory as that, albeit with a delay due to the incubation period, the fact that people get sick in the second week, and the fact that deaths occur weeks after the onset of symptoms. So I firmly believe the Spanish strategies are working because we're seeing it levelling out. And as we're seeing new cases level out, I firmly believe we will see a reduction in the increase of deaths, but it's appalling at the moment. Slowly decreasing in the amount of acute admissions, because that line's kind of going to go between these, isn't it? So the acute admissions again are going to be a bit lagging behind, like this, that sort of thing. But that they will fall. The acute admissions will fall before the death rates fall. So really hoping, in terms of acute admissions and deaths, Spain has just passed the peak. And that means we can expect to see a continuing reduction in acute admissions and a continuing reduction in the amount of deaths. Now, the United States is becoming another epicenter, I'm afraid. Now, more testing going on in the United States, which is good. And so basically up to 250,000 confirmed cases now. Again, the real numbers are going to be way higher than that. An extra 1,200 deaths, 1,200 deaths on Thursday. I'm afraid this death rate in the States will probably, almost certainly, go on increasing for some days, I am afraid. We have to be ready for a lot more deaths in the States, as their curve is still going up, and concerningly, it's still going up quite steeply. The number of deaths is going up steeply. New York City, over 1,500 deaths in New York City alone. 100,000 tests a day being performed in the state, so testing really is ramping up there, but it's still nowhere near where it needs to be for the size of the population. Now, Los Angeles and New York have ordered face covering when people are out. Not necessarily surgical masks, but to cover their face with a bandana or a cloth or something. So that's interesting. They've probably got some data that they're basing that on. We don't. The doctor at the White House, though, she said that they don't want a sense of artificial protection. So, like if you've got face covering, but you're outside and you're touching dirty surfaces, then you're fiddling with it. It's going to do more harm than good. So it's not a panacea. It's as well as everything else. It's as well as the social distancing. It's as well as the meticulous hand hygiene. War powers have been used to order 3M to produce huge numbers of masks, and they will do. Once American industrialization gets going, it can produce pretty well anything it wants in unimaginable numbers. But we've still got a bit of a lag effect, unfortunately. And again, people are making ventilators. I don't know about that. I've never heard this in the States, but I sincerely hope, as well as making ventilators, that they're going to make lots of CPAP machines, continuous positive airway pressure machines. Because while ventilators require a lot of expertise and other things to manage them, people on ventilators need intravenous drugs and fluids and special beds to prevent pressure areas, and they need drugs, muscle relaxants, they need sedative drugs. It's a whole intensive care to keep someone on a ventilator. Whereas with a CPAP machine, the patient can more or less manage it on their own. It's just a tight-fitting mask, and it blows into the patient's airway for them. Continuous positive airway pressure. So in my view, these are probably going to be as useful as ventilators are going to be. People tend to talk a lot about ventilators, but they're for very poorly people, whereas CPAP can keep a lot of people off ventilation. So hopefully they're doing that. So 2 cruise ships docked in Florida. The idea that people would be going on cruise ships a couple of weeks ago, I mean, it's just unbelievable that people would go on a cruise just a couple of weeks ago, and now the difficulty getting off these ships. There's a 3rd ship at sea. There's confirmed cases on both of the cruise ships that are being taken into care in Florida, putting great strain on the Florida health system, I would imagine. And of course there's the risk of cross-infection. But these 2 cruise ships, I think they're Dutch, but they refused admission to other places, so I suppose they had to go somewhere. But let's hope no one else is getting on cruise ships at the moment. And the other one that was really concerning, now, right since the start of these videos, we've talked about institutional spread. And the Theodore Roosevelt is a nuclear-powered, huge aircraft carrier in the American Navy. 3,000 sailors on board. And many of the sailors are in very confined conditions, sleeping just a couple of feet above each other, as far as I know, on bunks. So what that means is, if there's a positive case there, the spread around about the ship is virtually guaranteed, because it's very analogous to a prison or an old people's home with people living close together. And I don't know the full details of that, but it's certainly concerning that the captain's recently been relieved of his position. I think he copied too many people into an email or something, but always we've been worried about that. People in close quarters, these institutional conditions, we've always known that's always going to be a problem. And indeed, on this video, I've been warning about this since January. And yet, an organisation with all the brilliance, finance and sophistication of the United States Navy doesn't seem to have realised. I don't know, go figure. I don't know. How did they not realise that this is a huge risk? Why did they not realise this? Anyway, they didn't, it would appear. If they did, they didn't seem to act on it. Now, Italy, a lot of confirmed cases, a lot of deaths. I'm not going to work out the percentage of that to that as a death rate. I mean, we can see it's terrifyingly high, well over 10%, isn't it? Because I believe there's so many undiagnosed cases in Italy. And as we looked at before, and as I've said many times, when we look back on this pandemic in the future, I expect we're going to see that the death rate is around about 1%. I expect around about that. It could be slightly higher in Italy because of the demographics. But still, this is the overall approximate death rate we are anticipating, because there's so many, we believe, an iceberg of undiagnosed cases under the surface. 3rd week of lockdown in Italy now. Now, so increasing cases in Italy decreasing cases in Italy are encouraging in the north, but there's increasing cases in the south of Italy, which is very concerning because very often the facilities in the south aren't quite as good. And there's also reports of social unrest in the south of Italy. I think we all know that organised crime is waiting just below the surface to take evil advantage of any situation it can capitalise on. So that's certainly a concern in Italy. Canada, increasing number of cases. Now, the health minister in Canada was saying that their health system will be overwhelmed with the increasing cases. So I was very refreshed by her candour, actually. So we've got a senior politician saying, look, we go on the way we are, we'll be overwhelmed. Simple as that. So pleased to hear she's talking in these forthright, truthful terms. It means two things. It means we have to massively reduce the curve. Every Canadian has to try and take their part in reducing the curve. They need to reduce the spread of the infection. And it also means that Canada needs to greatly gear up its healthcare provision. And I really believe that levelling with the population like this, saying, look, things will be overwhelmed, to me, you give people the truth, they're then in a position to act on it, and most people will. And the Canadian Medical Association likewise pointing out to a crisis with equipment, not mixing its words, which is good. I can understand these words. I know what overwhelm means. I know what crisis means. These are words that we can understand and then we can act upon. Now, France, increasing cases, increasing deaths. Strict lockdown in France, though, so hopeful that will take effect. Now, this is another heading, Syrian camps. Quite a lot of refugees in camps in Syria and other areas in the Middle East, often in very poor conditions. Very little reported disease there so far, but my anxiety for these areas is very high. So I've written this badly today. That's a separate topic. That 160 tests per 100,000 people is the France figure. So that should be there. Now, this is poor. This is poor. For each 100,000 of its population, France has only tested 160. So very poor levels of testing there in France. They're relying more on the top-down lockdown measures rather than the targeted testing. And of course, we know we need both. Now, the UK, increasing confirmed cases, increasing deaths. Testing again, lamentable in my country. 163,000 tests done so far. That's 245 tests per 100,000, so we're slightly better than France, but that is no cause for self-congratulations. We're doing about 10,000 a day. The government have committed to doing 100,000 tests a day by the end of the month, so that's good. Let's hope they get to that. And eventually that's going to have to ramp up to about 250,000 to meet the full need. So the government now is fully aware, as indeed we have been saying on this broadcast for some time now, of the need for testing. Again, it seems governments are reacting as if they didn't anticipate this, but they've got the bit between the teeth now. Another thing that was concerning is the government was saying today that the antibody testing wasn't working. They've ordered 3.5 million of them, but apparently this antibody test is only about 90% effective. So that means in 10% of cases, it might say someone is immune when they're not. And if they're told they're immune when they're not, they could go back to work and spread it to other people. So 90%, not really good enough. I'm with the government on this, not really good enough. We need to do better than that for the antibody test of where the virus has been, the immunoglobulin test. Having said that, if it is 90% and we know it's 90%, then we can work with that and use the test as a rough indicator. But really, we need a much more accurate diagnostic test than this. This is not. I mean, this is good enough for a bit of epidemiology to work out what the death rates are, perhaps. but 90% sure. So, if your mother was in a ward and I said, well, I'm sending this nurse back to work, I'm 90% sure your mother won't get infected. It's just not good enough for healthcare, really. So, but again, the problem is known, the problem is being worked on. Just a pity it's taking so long. Now, the Matt Hancock, who's himself recovered, the Minister of Health in my country, is talking about he's only mooted the idea of immunity certificates. So he's mooting the idea of having a certificate to show that you're immune. If you've had this disease, you've developed immunity, you can go back to work, you won't spread the disease, and he's talking about certificates for that. And this, of course, requires differentiating one member of the population from another member of the population. Now, I get a lot of negative feedback, quite a lot, and I would say it amounts to hate mail when it comes to the idea that when I pointed out that in Korea and Taiwan and China, electronic monitoring through mobile phones has been effective. People have clearly very strong opinions about that. But what I would say, just as a simple scientific statement, making no political point at all, is that if people knew they were immune and could demonstrate they were immune, they would be remarkably useful. And for them, the lockdown would be essentially over. And they can go back to normal duties because they're not going to get the disease themselves. And as importantly, they're not going to spread the disease to other people. So something to think about from a social science perspective, which I am not a social scientist, thankfully. Peak deaths in my country could be the 12th of April. In other words, deaths are probably going to carry on increasing in my country for the next 9-10 days. And unfortunately increase significantly more than that. Very significantly more than that. Some government advisors are saying peak at Easter, the 12th of April. If they're right, and after that the deaths start going down. So what they're thinking is that's going to, what they're hoping is that's going to be the 12th of April there. Then it's going to start going down. I do hope they're right, but I think that's being somewhat optimistic given the lag we have seen in the onset of the lockdowns and the reduction in the death rates in Italy and Spain. So unfortunately, I would think peak deaths in the UK are probably going to be nearer maybe a couple of weeks after that in April. Let's hope I'm wrong. But just based on what we've just been discussing in Spain this morning, where we've got this appallingly long lag time, I do believe that is optimistic. Only time will tell. Now, Germany, apparently lower death rate, but again, we know these cases are nowhere. In fact, I might even stop putting these on. We know it's way more than that. Germany, though, doing well on testing, 1,106. So 1,106 tests per 100,000 of the population, so that's good. And they're currently doing 350,000 tests a week. This allows for a much more targeted, specific lockdown. It allows for isolation of infected people. It allows for quarantining of their contacts. So much better testing in Germany. Now, Russia, again, this figure in Russia's got to be way under, I'm sure. Now, deaths 34 again. I think it's fair to say that's based on incomplete data. Partial lockdown has been extended to the end of April, but it is only a partial lockdown. Now, it's been left to, I'm not familiar with this, Mr. Musiskin, I don't know. Anyway, is the Russian Prime Minister. So he seems to be the one that's giving the population the bad news, so the boss doesn't look bad. And the Prime Minister of Russia has said it is clear that the peak of infections has not yet passed. In other words, the curve in Russia is still going up. And we can't rule out the situation developing into the most difficult scenario. This is remarkably concerning. We've got the Prime Minister of Russia saying that the pandemic in Russia could be in line with the worst case scenario. And the worst case scenario is bad. And we know about the health challenges in Russia. The case fatality rate there could well be appalling. Now, Sweden is conducting its own experiment. It's doing it its own way. It's different to everyone else. And at the moment, we can't say they're wrong. I strongly suspect they are wrong, and I believe it will transpire that they're wrong, but at the moment we can't say they're wrong. They're trying it a different way. So the cases and the deaths, I mean, appalling, but lower than other European countries, it has to be said. But the thing about Sweden is it's at a much earlier stage. The disease started relatively late there. So whereas, Germany, we might be somewhere, Italy or Spain were kind of, the curves are high up like this. Whereas Sweden's probably only just in the very early stages here like this. So they've got a long way to go. Now, what I'm hoping is that the strategy in Sweden causes a nice flat curve. Like that. Like in South Korea. What I fear, and what I believe to be much more likely, is that this curve will not flatten out, but will rise more steeply. That is my fear, but as I say, we don't know. We haven't had a pandemic of this novel coronavirus before. We haven't had a COVID-19 pandemic before, so we don't know. So the lockdown, basically there isn't one as far as I can tell. Shopping centres are open, most schools and firms are open. Now, having said that, there are social restrictions, but nothing like the rest of Europe. COVID-19 found in a third of Stockholm's elderly care units. Now, this is incredibly concerning. A couple of days ago, you can watch the full video on this, we looked at a case study published in The Lancet where there was detailed case study epidemiology conducted by the Centre for Disease Control and the authorities in Washington State. And the death rate in the elderly care facility was appalling. I think it was 34%, I think. It was very, very high. So let's hope that Stockholm's not going that way, but that would be my fear. Additional hospital facilities are being provided. The healthcare system in Sweden is superb. So let's hope they can cope. And in their statistics, they're differentiating between deaths with COVID-19 and deaths from COVID-19. So basically, their argument here is that some people are dying with the disease. Now, what they're saying is, well, yes, this person here was dying of heart disease or dying of lung cancer or whatever it was. Oh, and they just happened to catch COVID-19 a few days before they died as well. So the COVID-19 wasn't the cause of their death, they just happened to die with it. That's what they're saying. It's not an argument I accept, because the time frame for the COVID-19 infection is short. It's an acute illness. So it's not like prostate cancer where you can have prostate cancer for a couple of decades and die of something else. It's a rapidly evolving disease. So I don't accept that. So I think that more of the deaths that are occurring in people who, to be fair, may be elderly, may have significant comorbidities, may have been terminal anyway, but I think that the vast majority of them have died more quickly from COVID-19 because they caught it, and that was the last thing that facilitated or precipitated their deaths. So not quite happy with the way the data has been collected there in Sweden. Now, India. 470 million people in India are labourers on the what you might call the informal segment of the market, and these can no longer earn money in the cities. The trains are all cancelled, the buses are intermittent, and so many of them are walking home to their villages in very crowded conditions, often with very limited food, so quite a difficult social situation there. Videos from India show crowded feeding centres for these migrant workers who can't leave the cities, and they're crowded. If the disease is there, it's guaranteed to spread. Dharavi is a large slum in Mumbai, and 2 cases have been confirmed there. Now, Dharavi is actually quite a well-organised slum. It's in the centre of Mumbai, and it's a real centre for local industry, very entrepreneurial area. So actually quite well organised, and it's been divided off and cordoned up. But many other Indian slums are bigger than Dharavi and are less well organised, much more chaotic, random, sporadic sort of places. People living in what we will classify as appalling conditions, truly appalling conditions, and the disease will spread like wildfire there once it gets into that situation. So my anxiety for India remains high. Israel actually took quite a lot of early measures. So Israel was one of the more proactive countries. So if it hadn't been for the early measures, that would be higher than it is. Again, I'm not sure about the amount of testing in Israel. I think it's fairly good. But the real figure will still be higher than that. How much higher than that, we don't know. Masks are required in public. We've argued about that before. Passover to be celebrated within the home. So a great annual event in Israel, but it's to be celebrated within the home. Now, more than half the new cases originated from ultra-Orthodox communities. Some estimates up to 60% from ultra-Orthodox communities, which are, let's just say they're now being more vigorously policed. Now, a lot of places are developing vaccine. Israel's one of them, and the Israeli vaccine goes for human testing on the 1st of June, hopefully. So let's hope that pans out. In fact, let's hope lots of vaccines pan out around the world. But there's lots of vaccines being developed, so I'm optimistic that some are going to pan out. Let's hope that's one of them. Denmark. Denmark, reasonable for testing. Again, the epidemic is increasing in Denmark. So Denmark's testing somewhere between France and Germany, better than the UK. Australia. Now, the pandemic in Australia, I'm glad to see, does seem to be growing relatively slowly. Let's hope that's maintained. Don't know what the deaths are in Australia, didn't get that figure. People are getting the temperature checked going in and out of various pharmacists and things. Now, the problem with this is that if people have taken paracetamol or I hope they're not taking ibuprofen, but if they have taken ibuprofen, this will lower the temperature artificially, so it's not a guaranteed thing to work. And as well as that, the temperature can fluctuate throughout the day. But I think it will deter people going out when they are not sure if they're poorly or not. So I'm not saying it's diagnostic, but if it gets people to think about it, then I think it's a good thing. And I think we might see more of that as time goes on in different countries. Now, Greece, again, getting the true picture is very difficult. But very concerning that there's a migrant camp in Greece with 2,500 people in it, in fairly close quarters. And there are positive cases in there, so the whole camp has been quarantined off from the rest of the country of Greece, as far as I can tell. But of course, that means the disease can spread through the difficult conditions in the camp. So, as we've said for months now, since January now, we're very worried about people living in difficult situations. The Syrian camps, the refugee camps in Greece, people living in institutions, indeed people living close to each other in aircraft carriers. So that is a major concern, that people that are already having great difficulty have now got an extra problem. Now, Europe, I'm just going to finish on this. The new boss of Europe, I can't remember her name now, but she said that Europe is demonstrating solidarity, but I don't see it. I see southern European countries struggling, and I don't see, to be quite honest, a lot of solidarity. And the only reason I'm mentioning this is what happens now in this period of time is going to affect the future of the world over the next decades. So if Europe doesn't get its act together, what's it there for? You know, if it can't cope with a difficult situation, what's it there for? There's great institutions in there, that they can do things, but are they? The World Health Organization we've already talked about has been lamentable. And world leaders will be judged on how they have performed and how they are performing now. World leaders will rise and world leaders will fall based on what they are doing now. So as well as the direct health effects of the pandemic, there's going to be many, many other effects. And that's all I'm going to say, because I'm not